Hospice care is often misunderstood and still mistrusted by many people. As a new hospice provider enters the Jacksonville market, the company is working to get the word out about how hospice care can help those with life-limiting illnesses. Heartland Home Health and Hospice is one of the nation's largest hospice companies and began operating in Northeast Florida late last year. Spiritual and bereavement care coordinator Emmanuel Wilson was once under hospice care himself. He spoke with WJCT's Karen Fagans about how that helps him counsel others.
I've heard, and tell me if I've heard this incorrectly, that you had a personal experience with hospice. Can you explain that situation?
One of the reasons why I am in hospice, I tell people that I am hospice. In 2000, I discovered that my bones were giving way on me, on the body, and I have had 3 spine surgeries, where the second one, the doctors did it through my stomach, and after that surgery, I had what you call bowel obstruction. And I was in the hospital for months. My bowels were not working. And it was very interesting because I was working in the hospital. And my colleagues came, doctors in white robes, around the table, and I was hooked up on so many poles of medicines and what have you. And the doctor, the chief surgeon, said to me, "You know, Dr. Wilson, you're the one that we would usually ask to go deliver this message, but we decided to come talk to you. We have done everything we can." And you can imagine, with a sound mind, laying in the hospital and being told by your friends and doctors that you have 2 months to live if your bowels don't work. And so they sent me to a nursing home. But you know, I was so fortunate that I had a good team of caregivers and put on hospice and offered palliative care, because the pain was very excruciating. And good gracious, I was so fortunate to have palliative care.
So the hospice care actually helped to make you feel better, and somehow you came through this.
Yes, you see, hospice is not a death sentence. It is to keep the patient as comfortable as possible. And whilst they keep you comfortable, in some way, miraculous or whatever, you may come out of it. And I've seen other patients like me discharged, come out of hospice and living.
I'm sure a lot of our listeners right now are wondering whether it's terribly depressing to deal with people and counsel people all of the time who are dying.
No, it is not terribly depressing if you love people. Your goal is to comfort them. You don't want to sugarcoat whatever is happening, but you want to help them with their emotions. And we human beings have emotions. When we reach that point of death, and I am also grief counselor for Heartland. So I know, and myself doing for my family and for my own life, I know what grief is. And it is a blessing to have somebody trained to come and hold your hand through that journey.
I've done news stories before about a fear in the African American community, especially of using hospice care, and maybe a lack of outreach in traditional hospice care to the African American community. Is this something that you have witnessed, and do you think it's something that's changing?
Well, I have experienced it, but then, of course, you know the history of African American, how we have been neglected in health care. And so, understandably so, there is that fear, not only for hospice, but we're afraid of health care, big hospitals. And that is understandable, checking on the history. But things are changing. I know that we're having more African Americans opt for hospice care. If they know what it is and they know the truth about it, and the family and the patient know that we are here to provide them with comfort care and palliative care. No one wants to see your loved one sick and suffering, excruciating pain. And if they know that that can be alleviated, they do opt for it. And things are changing, and we're having more and more African Americans opt for hospice. It's not just African Americans. There are people from other cultures that don't go for hospice for cultural reasons. For example, I know that if you are from some cultures, you don't want your doctor to tell you that there's nothing more he or she can do for you. The doctor's role is to cure, and these cultures expect the doctors to continue to cure. And indeed, the doctor is not giving up on you when you're on hospice. The doctor is simply providing a more comforting health care for you so that you can be comfortable.
Why do you think the Jacksonville community needs another provider for hospice care?
Well, we do have the Guru Hospice organization, Community Hospice, and they're doing a wonderful job. But like hospitals, no one group can take care of the whole community. No one hospice can take care of the whole community. So we are not in competition with any other hospice. We're just joining them to take care of the whole community. Just like you have other hospitals in town, they are not in. When I'm sick, I go to the hospital closest to me. You know, I'm not going to choose that hospital and run to that hospital. So we are not in competition with them. We are working together to take care of the community.
Well, thank you very much.
And I invite the world to come by and be cared for.
Emmanuel Wilson is a chaplain for Heartland Home Health and Hospice, which recently opened on the south side. The company is sponsoring next month's Art Walk in downtown Jacksonville and will have information available about jobs, volunteer opportunities, and outreach at that event on March 5th. For In Context, I'm Karen Fagans.